Continue. Good evening, everyone. My name is Chair Oni. Welcome to the Social Services and Health Services Committee meeting. Good to see you all here. Thank you all for bearing with me last month. I was granted a very last minute opportunity to take a religious trip during Ramadan, which is why I was not available the last Monday of March. So going to start with roll call. Thank you. Yes, it was very amazing. We can talk about it offline, but it was a great time. To start with the roll call, just call your name, and if you could state your name and your role on the committee for the record. We'll start with Vanetta.
Here.
Could you state your name and your role on the committee?
My name is Vanetta, and I'm a committee member.
Great, thank you. Sabin?
Good evening. Can you hear me?
Yes.
Okay, my name is Sabin Jacques, committee member.
Thank you for joining. And Mr. Cunningham?
Asher Cunningham, board member. However, I am visiting in connection to my role as Vice President Community Manager with JP Morgan Chase.
Fantastic. Thank you. So for the chairperson's report, the main thing that I wanted to share with you all was information that was passed on to me about SUNY Downstate. So as you know, we've been, in the battle first to save SUNY Downstate and then to direct the funding that was allocated to Downstate in a way that really best represents the community. Before I keep going, Samantha, would you mind? Welcome. Thank you for joining. We just did roll call. Could you please introduce yourself, state your name and your role on the committee for the record?
Hi, good evening. My name is Samantha Lawrence, and I am a committee member.
Thank you so much. So as I was saying, we've been, doing a lot of work to support SUNY Downstate, and at the beginning of the fight to support Downstate, a group was formed that is now called the Brooklyn Health Equity Coalition. It's members of a few different community boards, as well as community members, clergy, etc. And so they pass information on, and they passed some information on last month, at the end of last month, that the current proposal, after all of the hearings, after all committees have submitted their advising and stuff to Downstate, is still proposing to build a much smaller facility. It would have 100 beds rather than the current hospital, which has 342 beds. And it would eliminate the emergency room, but build up ambulatory care at the East Flatbush Medical Center. And they're also hoping that even though they would start at 100 beds, they would eventually move up to 200 beds. And so the Health Equity Coalition is pushing back because ultimately that reduces the number of beds that are in East Flatbush for sick patients. And we've discussed before that SUNY Downstate has a significant maternal health component and is really key to maternal health in our community. So I think that's something that we want to push back on. Good evening, Ms. Reed. Thank you for joining.
Good evening.
So I think the next step for us would be really helpful for Community Board 17 to share a letter. I did share a letter with the committee that was hosting the town halls on behalf of our committee and CB17 in general. And in that letter, I broke down all of the different things that we had listed out that we thought should be prioritized as Downstate is being sort of reorganized. So that's scheduling and patient management, accessible medical records, patient advocacy and alternative treatments, doctor availability and staffing, facility maintenance, community hiring, and nursing and staff support. And so hopefully those have been heard. However, I do think that it might be helpful to also emphasize just that the number of beds really matters, especially when it comes to things like maternal care, because people don't want to travel too far, from their families and their communities when they are in labor. So, shrinking the hospital to less than a third of what it is now would really negatively affect our community. So that ends my report. We can discuss it more during new business, but that's the information I have to share with you all. So the next item of business would be approval of the meeting minutes. We do not have quorum, so we would not be able to approve the minutes. So I'm going to move on to new business and just open the floor if any members have any new business that you'd like to bring up. Okay, hearing none, I'm going to open back up the discussion about downstate. If anyone has any thoughts on what I just said or ideas on actions that we could take other than sending a letter to advocate for, larger bed capacity at downstate.
I do have a
This
question.
is.
I'm sorry. Oops. Sorry about that.
Go ahead.
Sabin, you were first. You can go ahead.
Okay, sure. I believe the mayor, there was a mayor debate or discussion a few weeks ago, not even a few, maybe last week, at Medgar Evers College. And of course, with different potential mayor candidates speaking and vying for opportunity for this position. Is this something that's brought to their attention? Or in other words, is this something where there's a debate going on? I wasn't able to physically go. Are you aware of that? Because I sense that with local news, as right now, so much of the news is dominated in other spaces. With local community news, how are certain things covered so that they do not get lost? And because you have to keep shining a light on things, especially when it comes to local community, as opposed to what now is getting a lot of the attention, which is at a different point of government. I'm just curious. Is anybody aware of that?
I am aware of the mayoral forum. I'm not sure that we got to speaking about individual facilities because, obviously the mayor would oversee all facilities in all 5 boroughs. I also did not personally attend. I know several members of Community Board 17 did attend, but I don't know if specifically downstate was mentioned. I think to your point, it is something we can try and bring to the attention of mayoral candidates, but you have to remember downstate is a part of the SUNY system and also like a state-run facility. So the mayor, possibly could be a potential voice, in advocacy, but it's a state level issue.
Okay, thank you for clarifying that because I know with local politics, communities, how we get coverage is different from other aspects of politics.
Yes, I totally understand.
Thank you.
Of course. Vanetta?
Speaking as someone who worked at SUNY Downstate for a time, that is reducing the number of beds is very dangerous, especially when we have pandemics. And, with the COVID pandemic, it was a really difficult time for most of the hospitals in the New York area, to maintain the number of beds, or they had to build new areas for patient care or convert areas that weren't patient care into patient care beds to um, absorb the capacity of people that needed to be hospitalized. The other issue with particularly with the inpatient care is that the facilities have been not ma- not maintained and have been given low priority, and a lot of that contributes to the factors that lead a lot of people in the community. As someone who used to do prenatal care in the community, I would see the patient for their entire prenatal care, but they didn't want to deliver at downstate, so they would go deliver elsewhere at other hospitals in Brooklyn, because they weren't happy with the facilities or they weren't happy with what they were hearing about people's experiences at the hospital, which had more to do with the staffing shortage and the overwork. No, I would say overstretched, nursing care. And so they would go to other hospitals. So a lot of the issues with downstate have to do with the way that it has been neglected. And the fact that it is and some of that has to do with the fact that it's a state hospital, not, and we need to advocate. I do agree with sending a letter and pushing other boards in the community to stay on top of the state administration and make sure that they're making real concerted efforts towards improving the hospital and following through on whatever promises that they offer. Because, in the grand scheme of things, the amount of money that they've allocated at this point isn't really enough to do all the things that needs to be done. Um, and that's just a sheer reality of it. There are facilities that are being built right now that cost the amount of money that's been allocated by the governor for whatever downstate plans to do with that money. Um, so it's something that needs to be brought up in terms of the disparity in terms of what is allocated for this hospital versus what other hospitals of comparable size are building and are investing in their facilities and their staff and their overall operation of their hospitals.
Got it. Thank you. That's really important information. I think your point specifically about how overrun downstate was during COVID, and knowing that, God forbid, we don't want to speak into existence, we could face another pandemic. We don't want to sort of shortchange our community, and also the information about mothers choosing to deliver elsewhere is really helpful. So I'll definitely be sure to include that information. So I appreciate that perspective. Before we continue, we've had, I think, 3 people join the call since we did roll call. So, all right, Miss Reed, did I ask you to introduce yourself? I apologize.
No, you didn't. Good night, everyone. My name is Janice Reed, and I am a committee member. Thank you.
Thank you so much. Ms. Oluo?
Good evening, everyone. My name is Khadijah Oluo, and I am a community board member.
Thank you. And KS? I see you came off mute, but we cannot hear you. Okay, I see you say Kay Shelley in the chat. Okay, so for the record, that is Kay Shelley joining. Thank you. We can't hear you, but if you can get your mic to work, please feel free to come off mute. So the topic at hand is information that downstate is being proposed to be reduced from 342 beds to 100 beds, and how this committee and Community Board 17 as a whole could respond to that, the current proposal. So if anyone has any other thoughts that we can include in a letter that we're going to send, or thoughts of something we can do outside of sending a letter, would love to hear what you have to say.
Quick question. What are the elected officials saying in regards to this? The state ones.
So Hochul allotted, I believe the number was 750 million. And then a committee, like a panel, an advisory board, that's what they're called. An advisory board was composed of 9 members. One from a community board, I believe the person is from Community Board 14. Some, doctors and other community members. And ultimately they're supposed to make the final recommendation. And then the decision ultimately is like, it's somewhat of a financial decision. There would be like architects involved and such. So the state representatives were really helpful in the fight to just keep downstate open, but I'm not sure that they're as involved currently in the nitty-gritty of what's going to become of downstate, how it's going to be reorganized now that they've gotten Hochul to agree to keep it open.
Okay, so these, is it possible for us to find out who these members are?
Yeah, we know who they are. I know State Senator Myrie was really helpful in the initial fight, and Brian Cunningham, I would say, are the 2 in our area that we, 1, are in communication with their office, and 2, they were very active in the initial process.
The only reason why I'm asking is because if they are not from the community, and the fact that if they're just making these decisions off of just what they see, that can be an alley or a way that we can go about saying, hey, you, downstate is not being properly represented. One. Two, in regards to, are you looking at the health department and the state hospital departments of like, hey, what are you guys saying in regards to this? Because just for logistics, in regards to if there was another COVID, but we are seeing that there is respiratory issues are on a rise. Like, how do they plan to actually have some type of contingency plan if there was something like a pandemic, with them using only 150 beds? Like, what does this plan look like? Like, they drawn this out? And if they have, why have no, I'm not saying if everyone, but where is this plan so that the community and the staff and everyone else can actually see what this will look like and how this affects other hospitals too?
I think we're at that point where we can kind of try and direct things. Like less has been decided than maybe I'm making it seem. So if you remember, we had 3 community hearings, February, January, and I believe the first one was either November or December, probably November. And so input was taken in from those community hearings, and then other research that's being done, um, data that's being collected to figure out a plan to allocate the 750 million. It just seems that the leading plan right now that has not been adopted, the deadline to adopt a plan is June 1st. The leading plan reduces the number of beds. So when I was given this information, it was basically like, okay, so this is what we have in front of us. Give us your feedback. So I don't think it's a situation where anyone has officially decided, especially not anyone not in the community has decided, but it's more like, they probably worked with a consultant to come up with the final proposal. And the proposal says, hey, we think you should, reduce the number of beds, probably in order to like operational, like efficient, make the hospital more efficient. But I think at this point, it's for us to speak up, like especially taking points like Vanetta's, who had a lived experience of what downstate was like during COVID, and what expecting mothers have been saying about the facility, to step in and say, here's why that 100-bed proposal won't work. Does that make sense?
It does, but it still leaves a lot of explaining. Like, I know that we're saying, hey, this is where it's coming from. It's not definitive, but even still, I think if we're looking at ways to say, hey, this 150 beds downgrade is what it is, maybe we need to actually create an alliance and start talking to 1199 and saying, hey, this is what they want to do, which also then means that there's a reduction with staff, right? And impacts our community. Like, I think it should be something that is a cohesive thing that we're doing. We're not just coming from a one-sided that they're getting it from all angles, more so.
So one of the tactics you're suggesting is reaching out to 1199, which I think makes perfect sense.
Agree with her. I think that there needs to be some sort of coalition to give the message more of like more momentum, and involving people who work at downstate through the unions, and like you said with 1199, but also reaching out to like the clinicians who work there to make them aware if they're not aware, because a lot of times these decisions are coming from the top down, and they don't. I mean, they didn't find out that the hospital was going to be a COVID hospital until the governor announced it during COVID on one of his daily briefings. So making sure that everyone is aware of what is the direction that downstate is trying to go in, and make a coalition of people who build a consensus and say, no, this is what the hospital needs to focus on. I think that's very important, and also involving elected officials at all levels, because whether or not they're like, our state elected officials or our city elected officials or Congress people, their constituency is still in this community. And as a hospital in central Brooklyn, downstate covers a lot of territory.
And then I also say that we also need to look at with them doing that, look at the closure that we just recently had with Mount Sinai, how that will now impact, the fact that, hey, there will be a flux of people coming to not only to downstate, but also to Kings County. And if you're reducing it there, we don't believe that Kings County, Brookdale, and all these other hospitals have the capability to deal with that amount of beds, or may not have enough beds to service the whole of our community and just of the area of Brooklyn and as a whole. I think sometimes we have to look at it from like the ripple effect. Like, if you do this, this is what's going to happen, and this is going to create this here, which is then going to create shortage of staff going into Kings County, Maimonides, all these other hospitals, which then also then creates a lack of, this is what it can be, and this how much more money by you doing this, doing a cost analysis. Like, if you break down this, if you reduce it to this amount, this is what it's going to impact these other hospitals, and this is how much is it going to cost us. Sometimes I think they look at it from the, oh, yes, we have 725 million, whatever the amount is, but that necessarily does not mean that you can't find ways to do it. If you're really wanting to count, get rid of people, get rid of the heads, reduce their salaries versus reducing beds.
And I think the other part of it is that we are, you know, flying blind with respect to what is the actual operation of downstate. Like, it's kind of crazy to me that in a city like this that they're going to try to close an emergency room when most of the emergency rooms in the city are busting at the seams. So knowing what kind of volume downstate has in its emergency room in comparison to other hospitals, and determining whether or not that loss of that emergency room would be a big problem for the other hospitals in the area, and how much emergency care that they would have to accommodate to um make up for the fact that there was one less emergency room in Brooklyn.
I'm sorry. Good evening. Can I make? I would like good afternoon, Chair.
Sir, you are not welcome. You are not welcome on this call. Please leave.
I'm leaving right now, Chair.
Thank you.
I log off right now.
Hello.
I just got a few minutes and I realized I really wanted to stop into this meeting. Chair, I have a couple of suggestions, and listening to what Chair Oluwo stated, and I heard some of the comments from member Vanetta. I just have a few comments. One, I think that there is somewhat of a coalition that is working with SUNY Downstate, but I would love to see that our Social Services Committee kind of like lead the way with some of these conversations, because Claire Patterson-Mona, who is the community representative, is more than willing to work with the board. And so, not necessarily, I'm not saying for the member or for the Social Service Committee to become that coalition, because that doesn't make sense. But we can maybe create suggestions, ideas that push the narrative. That's one. I think that two, within that narrative, looking at 300 beds to 100 beds is a disgrace, right? To a community where the surrounding hospitals are in dire straits, and then to get millions of dollars where you can actually build up, right? You could build up, you could purchase property, you could do more things. I mean, literally across the street at Lenox Road right there, Lenox and New York, there's a facility, apartment building that they just built. So why is that the hospital can't use their own money or whatever they call it, the eminent domain or whatever the case is, and purchase property and build themselves, right? So that's two. The third thing, within pushing the narrative, is to maybe set up this social service committee can bring to our meeting, maybe we could bring that decaf, right? Our members of the decaf to just simply have conversation and take suggestions. Chair Oni, I will forward you an email from Dr. Simon Rabinowitz, that was sent to me today with some suggestions. I haven't completely read it yet, so I don't want to discuss all of it, but I know what it's about from our board member, Deborah Pointer. So this move at downstate and the spending, we have to just overall ensure that our voices are heard, especially since it is within Community Board 17. So just, I guess, maybe inviting key players as well. Alicia Goodridge would be a good person. Dr. Easterling, another one. Dr. Rabinowitz, the same one, sent me a letter. Other people we could discuss, or you can talk about who would you like to invite.
Are you saying come to this meeting or come to the general board meeting?
I would say to come to this meeting,
Mm-hmm.
because as a social service committee, you are Chair Owen, I believe you are part of that conversation, right? And you make the, even though I'm the chair of the board, you are the chair of this committee, and this falls under your domain. And so I think you vetting them, you talking about them, your committee talking about them, and decide if they should, if, when, and who should come.
Okay, I can reach out to them. I will, just to be transparent, we're under a bit of a time crunch because our next social services meeting would be the last Monday in May, which is Memorial Day. So I probably maybe shift it up to the 19th. And then the deadline.
No, not the 19th. You'd have to take one of those days after. Because I think the beginning of the month is when you have meetings, but I think you have to shift it after maybe maybe that fourth Tuesday, probably the following day. I don't think let me just check the calendar.
Okay.
Let me check the calendar and get back to you.
We shift it because we wouldn't meet on Memorial Day. And then the Brooklyn Health Equity Coalition, or no, not the Brooklyn Health, the Downstate Advisory Board has to submit their recommendations to HOCL by June 1st. That's the deadline that HOCL has given them. So we have like a little over a month.
Okay, so the available dates is the Monday is not available, the Tuesday is.
Which Tuesday?
The 27th.
Okay.
So you could move your meeting to the 27th.
What about Tuesday the 20th?
No, that's commerce. And the 19th is, I believe, sanitation. You have the 12th and the 13th, but it's a little bit too early, I think.
Okay. I'll talk to the office to confirm, but pending for the 27th.
Okay.
And I'll reach out to Ms. Goodrich, and if you can forward me that email also to the
yeah, let me do that. Let me do that right now so I don't forget.
Thank you.
Forward it to you now.
Okay. So I appreciate everyone's, thoughts here. As the chair said, the Brooklyn Health Equity Coalition does exist and has been having conversations, but I think what we need to figure out is, what's the definitive statement that we want to make? I'm hearing from everyone, obviously, that reducing to 100 beds just does not suit the needs and capacity of our community, as well as eliminating the emergency room is going to just further stretch downstate and Brookdale, which are already, at capacity. So is there anything else, like any other specific points that we want to make sure we get across as we're communicating both with the coalition and then eventually with the advisory board and the governor?
Chair Oni, please remember that technically Downstate is the only hospital within our community. It's the only one. There, Brookdale, some of its building are in our area, but we don't have it. The emergency room, I believe, is not. Kings County is in Community Board 9. Mount Sinai and Maimonides is, I think that's Community Board 14. So Downstate truly is the only complete hospital, well, almost complete hospital with an emergency room within Community Board 17.
Mm-hmm.
So that's another point that we need to stress out for a lot of individuals. And we want to make it more useful, not less useful.
So another one of my questions, because I'm not clear, and I don't know if this is something that in the past has been brought up. I never understood why SUNY Downstate wasn't included in One Brooklyn Health, because that came with some additional funding to upgrade facilities and create more outpatient clinics. And ultimately, there's going to be some plan for, a birthing center. But for whatever reason, Downstate was not included in that when it was put together. Instead, nearby hospitals, Kingsbrook merged with with Brookdale, and they formed a One Brooklyn Health along with other things in the area, and they've built out all these clinics. And it's just, that's one question I've always had. The other thing I wanted to just comment is that I'm going to try to reach out to some of the clinicians who still work at Downstate and see what things they are noticing at this time that they consider to be things that they want improved.
I wasn't on the board when the OBH merger happened, so Mr. Daly, if you have any thoughts on that, would definitely be interested to hear. But thank you for your suggestion on reaching out to people. I think that would be very helpful.
I was on the board and I was part of some of the conversation around One Brooklyn Health. One of the things that they wanted to do was to change where programming is for specific things. So like for rehab, it would be Kingsbrook. For psych, it would be another one, or that's what they wanted to do, to streamline where patients needed to go. That kind of shifted how people addressed the hospitals, but I know it created an issue in another sense because there was no real true emergency room that people could go to. For example, Kingsbrook emergency room, they more or less got rid of that one. And then Brookdale's emergency room became more burdened, while the rehab became easier, things like that. But that's the best that I remember. It's been years now. It's been about 5 or 6 years that happened. So maybe we could look at Sharon Lead, I believe, Devonish, who was the VP at One Brooklyn Health Downstate, to have a better conversation, or whoever her replacement is, because it was also Kerry Edwards many years ago before he stepped down to run for bar president.
Okay, thank you. I guess as we continue to talk to people, we can ask. I obviously don't think we can change that to get Downstate into One Brooklyn Health, but I think maybe we can point out, how that also continues to affect residents in CB17, because to your point, with this being the only hospital that's fully, or the only hospital with an emergency room in our district, like the fact that it's not part of that wider network, but then is also being under-resourced is like unfair to CB17 residents. Okay, I mean, we could talk about Downstate for a long time, but I think I'd love to get some next steps on the table. So I'm going to take the notes from what we discussed today and draft a letter that I can share around. Also, we'll reach out to the people that Chair Daly mentioned before to see if they're able to make our next meeting and see if that date works. And then I'm curious if there's anyone here who, wants to be more involved. Like, could you help us if we're going to plan a CB17 event within the next 30 days? Would you be able to help support with some of the event planning? Please let me know.
I'll help you.
Bless you. Thank you. We'll also share an email to the wider CB17 community to see if there's anyone who maybe, isn't joining these meetings but wants to be involved in these conversations, because we need to, do our part to make sure that this hospital in its refresh is really serving the needs of our community. Okay, so that was the new business. Does anyone have any other new business that they want to discuss? Okay. Okay, and then is there any old business to discuss? Hearing none.
Hey, quick question. Was this committee planning an event? I came on late, so I didn't hear. Is this committee planning an event from now until June? I thought, maybe I missed the first part, so I'm not sure. So I just want to ask.
No, you didn't miss it. We had discussed previously potentially doing a health fair in June again. But right now, with the way the capacity is, I think that we're best served by putting all of our efforts into the fall event.
Okay, so got you. So, well, it could be, I guess, a /health fair, community /health fair. Is that the idea, or no?
Mm-hmm. Yes.
Okay, thank you.
So as I mentioned at the general meeting, we're looking towards a weekend in October. Hope to finalize the date for that before the next meeting. And then we'll start the planning for that in May. So again, if anyone here would like to be involved in the planning for the fall community fair, community and health fair, please let me know. And we'll, be asking other people on the board to do it so that it can be even bigger than last year. Sabin, I know you usually have a lot of ideas about our events and such, so could I lean on you as we're planning the fall event?
Sure, definitely. I also wanted to share that I don't know how this would work. The garden communities are pretty big, and usually with the fall, it's where it's going towards the tail end. And so, again, I just noticed sometimes there's separation and not overlapping of different things being done in the communities. So I almost feel like I can mention this and then we can talk offline as to how can we, again, this is just thinking future. It doesn't mean we have to commit to it. Leverage maybe some of the garden communities who might want to work with our committee to do something if they can assist, if they can bring something to it, because the garden communities are pretty big. And like I said, the fall is a big time when they kind of wrap up things. And so maybe it's a different vision as when we're doing fairs, you know? So this is something, it's slightly different, but it's just being maybe a little creative, a little innovative, adding something different.
Yeah, I'd love to discuss further. I know Chair Daly was really helpful with Seeds in the Middle that brought their farm stand to, what's it at Meyer Levin now?
Yes, is that as a matter of fact, on Friday, they're going to do a grand opening. So if anybody's available between 10 and 2,
Okay.
they'll open in the garden at Meyer Levin, which is right at the corner of Beverly and Ralph.
Okay, I should
In fact,
probably.
I'll be there, probably.
If you can share it, I'll share it with the rest of the committee as well, if people can attend.
Okay.
Is that again, Mr. Daly?
Friday, May 2nd.
Okay.
And also, PS 235 is having theirs too, right next to Downstate, as we talk about Downstate. So I've secured both schools to do the initiative for Seeds in the Middle.
When is 235? Do they have
That
an
I don't,
open?
that I'm not sure of the date. I will have to, what I'll do is I'll do it. You know what I can do, Chair Oni, is, as a matter of fact, what I like to do things immediate because I'm forgetful. I'm going to connect you with Nancy,
Okay.
and I'm doing that right now. So the two of you can, and so she can actually share the information with you as well. So you can also submit that, share that with your committee.
Okay. Sounds good. Yeah.
All right.
Yeah.
Did you? I just sent you the other email as well.
I got your first email. Second one will probably come in a second. Yep, got it. Thank you. Okay, does anyone have any more unfinished business? I think, yep.
Just a quick announcement. The flyer's not out yet, but I'm also reminded, well, several announcements. One, for everyone to go to the website, look at the website, look at information, check the calendar for different meetings. The 21st is our general board meeting. That's one. We have several other committees that are there. One event that's not on the calendar, but will be happening next week, Thursday. The Community Board 17, we are collaborating with the council members to do a town hall at Mile 11 from 5:30 to 8:30. The kids are going to be performing, so we kind of extends to give them a chance to perform at Mile 11. So that's next week, Thursday, May 8th. But please do check out on our other committees and to ensure that we continue the participation and active in what we're doing. That's it. Thank you.
Thank you very much. Thank you for everyone who joined. Appreciate the discussion and the input. As I said, I'll circulate a draft email to share with the Brooklyn Health Equity Coalition, to move upwards to the advisory board and eventually the governor, and also reach out to other stakeholders that we can invite to our next conversation and spread the word that they'll be here. So hopefully we can get a little bit more participation next month before that June 1st deadline. We're also looking to work towards the fall fair and potentially involve some community gardens and such. So we'll be in contact with all of the above. I appreciate your time. Appreciate you, Mr. Daly, for joining and adding some helpful insights. And with that said, can I get a motion to adjourn the meeting?
I motion to adjourn the meeting. Hi, Khadijah.
I second it, Vanetta Sylvester.
Thank you so much. With that, I declare this meeting over, and I hope you all have a wonderful evening. Thank you all so much.
Thank you. Let's have a great night.
Have a good night. Thank you, Lions.
Good night.